Yeah, thank you very much. It gives me absolute pleasure to introduce the next speaker, Dr. Pukar Shrestha, a very close friend of mine and close friend to the whole of the Newcastle team. Pukar, there's so much written here about you. I'll try and summarize it. You have been absolutely instrumental as a leading figure and as a visionary in Kathmandu and in Nepal as a whole in pushing forward kidney transplantation and now liver transplantation. There is absolutely so much written here. We could sit here forever listening to everything that you've done. But I would be very, very interested to hear your talk, which is about the journey in liver transplantation and what you have started and what you're about to continue. So the floor is yours, Pukar.
Thank you, Eamon, and thank you, Cheers. I'm really privileged to give a talk on liver transplantation from Nepal. After exactly 8 years of start of the successful kidney transplantation in the country, and after 3 years of establishment of the dedicated transplant center in the country, and after a week of approval of the acts and regulations about liver transplantation in the country, we have been successful to start the liver transplant in the country with the help of foreign experts successfully. I think liver transplant program anywhere in the world probably has not been started this much quick with successfully in a country like Nepal. So we had to start a liver transplant as well, even in a short time of successful kidney transplant program, because we have the incidence of liver diseases from both alcoholic liver disease as well as the viral hepatitis. So we had no choice but to start the program sooner than later. As you know, the current burden of the liver diseases is 1.9 to 2.4 million. And which has increased from 1990 to 2007. This is a global burden in 2017. We had very limited option to treat the liver diseases. Only by medical means till we started the transplant itself. And as we all know, life-saving treatment for the liver transplant, so for the liver failure patient is nothing but liver transplant. There is no dialysis for the liver failure victims. So we had no choice but to start the program. And Syed Dharma Bhakta National Transplant Center, which is a leading transplant center in the country, established by the government of Nepal 12 years ago, had to start the liver transplant program. When we even conceived, we had very lack of human resources. The infrastructure, we definitely had to start from zero. Financial concern, liver being the most expensive and most complicated surgery in the whole medical world. We had no acts and regulations. And of course, lack of awareness. People hardly could believe that liver transplant can be possible in Nepal in that quick, session. So, we try to explore, we try to prepare, we try to make ourselves confident how to start, where to start, and when to start. That was the question. We had series of meetings with different international experts from India, from UK, from US, and from Korea. And Dr. Kwan and his team from Samsung Medical Center in Seoul had been very kind, very supportive to help us start the first liver transplant in the country. Dr. Neeraj and myself, the leading our gastroenterologist who was here in the session before, we were in continuous touch with the team from Samsung Medical Center, and they agreed to help us and we first liver transplant, live donor liver, that too, not the deceased donor. I was trained in the deceased donor program in England. But Deceased donor program to start with in any country is not that easy, as Professor Gupta also mentioned. Deceased donor program is not in your hand, not in the hand of one or two hospitals. It is a whole state's program. So live donor program was our first option, and we started it on December 2016. So, as I said, before we could do it, it took 8 years for us to prepare, to make our acts and regulations, to draft it with the support of different international and national experts. Professor Guleria is here. Professor Dori was here. There's so many international faculties who help us to make our proper acts and regulations suitable for us. It took 8 years to convince our parliamentarians, our bureaucrats, to approve it. And as we started the first successful transplant program, we didn't take long time to start the deceased donor program. Deceased donor program, deceased donor kidney, we started in 2017 after 1 year of the acts and regulation. And after 3 years of the live donor liver program, we could start the first ever deceased donor liver in the country by our Nepalese team, independently. So this is the first successful liver transplant done with the help of Korean team. So if you see the number of transplants we have been doing, first few years we could do one only. In 2016, 1, 2017, 1, 2018, 1, 19, 1, 21, 21, also 1. And then gradually, last few years, you can see this graph. We have progressed. In 2022, we could do 3. 2023, we could do 7. We're doubling now. And 2024, we could do 14. That means we are in the right track to do the liver transplant in this country. If you see the demographic data, most of our recipients are young age, 46 years, and donors younger than that, 35 years of age. So we are relatively healthier, younger and recipients compared to the other series of the world. Males are predominantly the recipients. And you can see, as in kidney, females are the donors. The same story. If you see, province-wise distribution of our patients, of course, the Bagmati province, the capital, has got more number for the donor and recipients. If you see the etiology, alcoholic disease has topped our list, almost 60%, followed by the hepatitis B. Yep. But if you compare this list with other hospitals of the country, Bayer Hospital, which doesn't do the transplant but deals with the liver diseases, again they have this alcohol disease as number 1 etiology for the liver diseases, followed by the hepatitis B. Whereas if you see the data from United States, which is not the data from transplantation, they have the alcoholic liver disease as number 1, followed by the hepatitis C, rather than hepatitis B, and then cryptogenic liver disease. So slightly difference in the etiology in the American reports compared to us. In our transplantation, the male risk score, average was 22, minimum 16 and maximum 27. We had most of the graph from the right side, 78% graph from the right side, and GRWR was very good, 1. The hospital stay, if you see, is at very, I think, comparable to any other centers of the world. 16 days for the recipient in average, whereas donors, we could discharge even on 8 days in average. The survival rate, if you see the total number of among all the liver transplants, 1 year survival was 86.6%, though our series is very small. We have a long way to go. And 5-year survival, you can't believe it, because we do 1 liver transplant a year. So if we see the 5 years survival rate, all the 3 liver transplants had survived 5 years, the first 3 ones. That means 100% 5-year survival. We cannot conclude like this, being a very small number, but if you see the comparison of the 5-year survival of other centers from Asia, 75%, and from Pittsburgh is 67%. If we said, we have done 50, 100, probably our 5-year survival would have come down, but we have done 1 in Asia, so our 5-year survival has been unbelievably 100%. And if we see the death census graph survival, it has been 86%. The recipient mortality, if we see in the living donor liver transplant, 2 out of 27, which is 7.4%, I think it's consistent with about 10% of the world's standard. Of the 2 mortalities, we had 1 AKI, acute kidney injury, probably due to tachytoxicity, and when we minimized the immunosuppression, patient had the rejection. So, and ultimately graft failure, and we lost that patient. Another one, after 7 years of transplantation, we lost one because of the ischemic heart disease. And we have no donor mortality so far. We have been very lucky. We see the complications. We had 1 bilioma, 1 biliary stricture needed, intervention, stenting, and dilatation and stenting. We had 1 immediate laparotomy for hemorrhage for 2 patients. We had sepsis among 2 patients, chest infection, aspergillosis 1 each, catheter-related UTI 1. We had acute rejection among 2 patients treated successfully, and 1 infection, deep 1 infection in 1 patient only. Among the complications in the donors, we had leukocytosis for the reason we don't know, ultimately normalized. We had urinary infection and decreased hemoglobin levels, which we couldn't explain but ultimately recovered. We had 1 3-year-old boy who had hepatoblastoma and had a live donor liver from his mother, 30-year-old, and the recipient discharged on day 10 and donor on day 8 successfully without any event. The program has now spread to other centers of the country, both private and public. TU Teaching Hospital has started liver transplant in 2019. They have done 15 so far. Chittagong Medical College started in 2021. They did 7. And KISS Medical College have done 7. Total, we have done 59 liver transplant in the country. Cost factor, I think liver transplant program probably the cheapest of the world. Transplant center does the liver transplant in $12,000 to $15,000, whereas teaching hospital costs about $18,000 to $23,000. The KISS Medical College, the private medical college, cost about $24,000 to $27,000. Conclusion. Liver transplant is said to be most complicated, most expensive, most challenging process in the medical science, but has been initiated in Nepal within 8 years of the successful kidney transplant. The results have shown the promising results. We claim that this is probably the cheapest service in the world, and for excellent result. We still believe that we should take the help from foreign experts to prevent the casualties. I have a long list of acknowledgements. I cannot mention all, but of course, our surgical team from Transplant Center, our anesthesia team, our hepatology is gastroenterologist, Dr. Neeraj, Dr. Dipesh, and Dr. Sekhar, and our international partners. Definitely want to recall Professor David Kwan from Samsung Medical, Professor Subhash Gupta from Max Hospital, Delhi, and Dr. Selva has been supporting us. We have got a resource team, politicians. I remember Minister Gagan Thapa, who really was the instrumental to initiate the liver transplant in the country. So was the Professor Dr. Praveen Misra, Health Secretary, and the Present Health Secretary, Dr. Roshan Pokhrel, have been all supportive to bring our liver transplant program to this level. Thank you very much.
Thank you very much, Dr. Pukar. This from scratch, like you've done. And liver transplantation is no mean feat. And it's not just the surgeon that needs to be trained. So who is your team? Who have you taken with you on this journey to train and to reach the numbers that you've reached now?
It's not only me. It is a huge team. I think the names I have shown was not in. It's a small bits of the whole team, but whole country, government, the institution, and the international, our colleagues, friends, good wishes. And Dr. Guleria is laughing when we started the very first transplant. So I don't name one or two guys or one or two teams. Whole world was with us to start the program, but I'm definitely grateful to Professor Talbot and his team from Newcastle in Freeman Hospital, who made the foundation to start the program and has, been possible to bring to this level. Thank you very much.
Any further questions?
Best transplant program in the world. So what's your plan as a chief of the transplant hospital to retain the manpower in the country and in the center itself? What are your planning for that? Because most of our colleagues, they're not staying in Nepal itself. So what are your future plan? Because it's very difficult to work, because to say it's the cheapest program in the world, but to retain manpower at this time is very difficult. So how will you address, sir? I want to listen to that.
I think that's very, very important question. Great in terms of volume compared to private hospitals. Private hospitals are leading, in the liver transplant program, probably because of the retaining the experts with little pay and more challenges. So that challenge, not only in Nepal or India, it is everywhere, in particular in developing country, because the facilities in state hospitals are very limited and not enough to meet the demand. That is a very, very important and very difficult question to answer. I think somebody from state authorities should be, answering that question if it should be if it is appropriate. But from my opinion, we should request the government to increase the facility of the experts in the state hospitals, so that they can be easily retained and continue the service. So far, the transplant center, which is under the Ministry of Health, has been, playing a lead role to do the liver transplants, to maintain it. But, the question you have asked, lots of people come and go. That is happening. And it might not be easy to retain them long. If that keeps on going, then the program might be gradually taken over by the private hospitals, and state hospitals will lag behind. I fully agree with you.
Any further questions?
Thank you very much.
So you are the pioneer in initiating the transplant work in Nepal. Give him a big applause. Thank you, Dr. Pukar.